I want to thank the Brain Health Initiative for giving me a simple but brilliant invitation to change my language. I believe that changing your language changes your mindset, changes your results, and the impact you can have in our world. This simple invitation was to stop using the language mental health and instead start using the language brain health. And I believe that that language change will be vital to igniting a revolution. Imagine your loved one begins to feel ill. You seek medical care. And in that medical care, it is identified that this individual has significant disease in their liver. And as the healthcare team starts to put a treatment plan together, this is the best recommendation they have. They let you know they've been able to get you an appointment with a specialist in 6 months. They give you a medication that has an efficacy just a bit above placebo. And then they recommend that while you wait for your appointment for this significant illness, you might want to seek out some services online or seek support of untrained professionals and family. I think we all would agree that we would be furious if that was the response to a disease or illness in our organ called the liver. Now imagine, while waiting, that person passes away, that person dies of their illness. Just imagine that when we write the obituary, we say something like, in an untimely and unexpected death, we have lost a loved one. I think you would be absolutely outraged. I think you would demand that those in this legislative branch would do something, that those with the powers that be would do something. Now imagine that when you filed that claim with your insurance company that you've paid your premiums to for a great deal of time, they say, wait a minute, we have an exception. If it's a disease of the liver, we don't pay all that well. I think you're starting to see that this is not at all the type of healthcare we want for the people in our lives. Here's what you don't have to imagine. If that illness or disease was not in your liver, but in your brain, that's exactly the type of care you would receive. I am so grateful to the Brain Health Initiative because they're asking us to change our language so we can lose the stigma and we can quit pretending that your brain health is any different than the health in any other organ in your body. Since simply overhearing the suggestion to use brain health rather than mental health, I now, on every stage I appear on, in healthcare or otherwise, make sure and use that language to interrupt people's thinking so that it starts that level of learning that we're all working for. I would encourage all of us, change our language and then change the care we provide to people who have brain health issues.